Dr. James Haberfield from the Unusual Pet Vets. Today's video we're going to be showing you how to inject your snake. Now for a lot of snake owners, hopefully you'll never have to worry about this, but if your snake does have any common illness, often they'll be on medication which does unfortunately sometimes need to be injected. The reason that some of the medications need to be injected and not given orally is that they last for a lot longer and they are more effective for certain conditions as a general rule, depending on what you're dealing with. Sometimes oral medications are more appropriate, and if you need help with that, please see our other video. Okay, so what you want to do when you're about to inject your snake is you want to have obviously been shown how to do that before, but with the vet that you got in the medications from. It's not something you want to tackle on your own if you've never done it before, because it can be quite daunting. Essentially what you'll have is you'll have your syringe and your needle on it. Often they'll be frozen and you'll need to defrost them as you go for these guys, for the most commonly used medications. If they're not, what you need to do is draw up the medication from the bottle, and your vet can run through that with you if you're not comfortable with that. Once you've got your medication all set up, what you've basically got is the syringe, the needle and the needle cap. Now when we're ready to go, we're going to just gently pull the syringe cap off. You've got your needle and your syringe cap, and then you're good to go. Just a few pointers before we restrain and how to go and show you how to inject it. It used to be thought that you could only give the medication in the front half of the body because of the way that some reptiles have the ability to filter out certain medications with their kidneys. That's recently been sort of also thought to be more of an academic phenomenon and not something that we see clinically. So I think in general, most of the time you can inject anywhere along the snake. The areas we say to avoid is obviously around the head, too far down towards the tail, and over the area of the heart, which is about a quarter to a third way down the body for most snakes. What are you doing? So basically, once you're ready to go, you want to have your snake out, you want to have your medication ready to go as well. If you're not comfortable with this and it's something that you haven't had a lot of experience with, definitely it helps to have a second person to help restrain. If you are on your own, another way that you can help to make it easier for yourself is to put most of the snake's body into a pillowcase or a snake carrier bag. And basically what they do then is only pop out, you only sort of pull out one coil, and that one coil is where you inject. And that way the whole snake is in the bag, and you don't have to worry about sort of injecting while it's trying to move around, because you've got it controlled in the bag. So it's just up to you. I'm going to show you how I do it with just one person, but if you do have a second person, it is often easier when you're learning. Now, a couple of things that we want to think about before we inject. Ideally, you want to go, most injections in these guys are either subcutaneously, so under the skin, or into a muscle. Now, either of them, your veterinarian will be able to tell you what you need to do for your snake and the snake medication that you're on. But with either of them, what we want to do is when we're going through the body, you want to go in between the scales rather than through them if you can. Each scale has a little gap between them, and if you can go through there, you'll create less damage to the actual scales themselves, which is nicer for all involved. Alrighty, so once we're ready, what we're going to do is just restrain the snake by grasping their head, if you're wanting to do that. So just gently around there, that way there's no danger of them biting you. You're going to wrap them around a little bit and hold a coil in your hand. So you can see here I've got a coil in my hand, so we can inject along there, which we'll run through in a minute. In general, with most snakes, I'll just let it go for a sec, what you're going to be doing is injecting along this top half of the body, the top half of the body if you're looking at it in a sideways plane. So you don't want to be going underneath, you don't want to be going directly on the top, you want to be going onto the side and up the top of the body, and that's generally the safest area there. It's quite a bit of muscle under there, you're not going to accidentally puncture something you shouldn't very often, so that way you're nice and safe and comfortable, and the snakes generally tolerate it fairly well. So we'll do that. So what I'm going to do is just going to wrap him up again, just grab his head gently, okay mate, and then just grab a little coil and we'll go down and have a closer look on how to inject him. Okay, so as you can see, I've got his head restrained in one part of the hand and the body with the other. He's wrapping himself around, so he's happy to stay there. Just going to take the needle cap off. We've got our needle there ready to go. You want to have the bevel of the needle, which is the opening, facing up towards you. You don't want to have it down there ideally. If you can turn it to have it facing up, it'll mean that the liquid is squirted along the skin rather than down directly into the muscle, or depending on what injection you're doing, you can go straight in as well. But you know, for most occasions, you want to have the bevel of the needle facing up. Okay, so when you're ready, basically what we want to do is pick a scale. So you can see there, I'm just going to go in between those scales there. And, alright mate. So the snake will tense a little bit often, that's quite common. So you can see we're under there, we're ready to go. And once we've got the needle in there, you're just going to inject. You'll get a little bubble on there. You're going to pull it out, and as you pull it out, you're just going to keep a little bit of pressure on there so that any liquid doesn't come out. Done. So what you'll see afterwards is you'll see a little bubble there, and you can see it's obviously that it's the same as a human having an injection. It does hurt a small amount, so that's why they don't. That's why he was hissing a little bit before. But you can see that little bubble under the skin there, and then you know you've gone in the right direction. So I've gone down about as low as I'd go there. Most of the time you could go up a little bit higher and up towards this area there. I wouldn't go too much lower than where I've gone today. So that's absolutely fine. So that's all we had for today. So if you have any other questions or anything that you wanted to talk about or ask, please don't hesitate to get in touch and we'll do our best to help you out. If not, thanks very much for watching and have a great day.